I'm Richard Matthews. I'm a consultant cosmetic and reconstructive plastic surgeon, and I work at the Nuffield Health Warwickshire Hospital, which is where my private practice is based. I also operate at the BMI Meriden Hospital in Coventry, and I consult at the Renatus Clinic in Rugby. And I hold a substantive consultant post within the National Health Service. Prominent ears are really quite common, and children from about the age of 5 or 6 will begin to get teased about their ears. Some people with very strong personalities that doesn't happen, but most kids get teased if they've got ears that stick out more than a certain amount. And it's good to get something done about them. Some people get past childhood without anything having been done, and again, if they're strong personalities, they don't let it interfere with their lives. But a lot of adults who get past that point get into adulthood and feel extremely self-conscious about their ears. For women, it's perhaps easier to disguise that with longer hair, but it's restrictive in terms of what sort of hairstyles they will adopt. And even then, sometimes the tips of the ears will peep out from their hair, however carefully draped. And for men, of course, that's more difficult. Wearing long hair may not be an option at work or whatever. For adults, the surgery can be carried out under a local anaesthetic with some sedation if they wish, either by mouth, by tablet, or an injection given by an anaesthetist, or alternatively, if they feel they can't face that, they can have a general anaesthetic as well. The surgery is carried out by means of accessing the cartilage. The cartilage is what is responsible for the contour of the ear this way and that. The skin on the front, the skin on the back is simply a covering of the cartilage sandwich in the middle. A certain amount of skin is taken away from behind the ear, and that allows access to the cartilage. Usually the problem is that this fold here is missing or is weak, so that the ear stands out at that point. And it's a matter of creating a fold like that and pulling this outer portion of the ear in with it. And that will correct the problem. Less commonly, but nevertheless sometimes occurring, is a width of the well of the ear here, which is too wide, and that causes the ear to stand out. That may occur together with a lack of a fold or just by itself. In that case, one needs to remove a proportion of this well of the ear to get the ear to come back in. That's a slightly more complex procedure, but perfectly achievable. This is a good operation. It does a tremendous lot for people's self-esteem and helps them to fit into the world around them, both socially and in the workplace in terms of getting and applying for work extremely well.